Um, Hi, I'm Claire. I'm the Senior Net Zero Programme Manager, which is a very convoluted title for being the Regional Sustainability Manager for the North East and North Cumbria. So I'm leading the team in our journey towards net zero, and I'm going to take you through why that's important to the North East and North Cumbria. Our ICS Green Plan, which I think you may have all seen. So I haven't got it on the screen, but I could if that's what you would like. But I'm going to give a little bit of an overview. And rather than going into any great detail on lots of projects that we're currently rolling out, I'm going to concentrate on a clean air project that we're doing, because obviously this links very well with health inequalities. So yes, Ashley, do we want to take questions at the end, or are we just going to go do them as we go through? I don't mind.
However you want to do it, Claire, whatever works better for you, because we're only a little group here today.
Yeah, that's fine. We could just do them as we go through, but I probably won't be able to see hands or anything, so you might just have to butt in.
Yeah, that's fine. I'll keep an eye on that.
Cool. Okay. So why this matters to our communities, I'm preaching to the converted here. So sustainable healthcare is a vital part to play in our ambition to reduce health inequalities, improve overall health of our citizens, and prevent ill health. Essentially, the climate emergency is a health emergency, and that is the premise of everything that we're doing. I've been in this role now since January, so coming up for 9 months. I came from one of our provider trusts, so I was the environmental and sustainability manager at North East Ambulance, and I used to do some more estates and facilities type stuff. This kind of was a good development opportunity for me without having to totally let go of the NEAS end of things. I'm really interested in the green fleet, etc., etc. So, which obviously clearly links to a lot of this stuff. So the facts obviously speak for themselves. 9 of the 13 local authorities in the area have a healthy life expectancy of under 60 years, which is just horrendous. In the entire south of England, including London, there are only 4 out of 67 such authorities. So that kind of puts it into perspective. Significant levels of health inequality stem from the historic industrial jobs of the North East and North Cumbria, and have had this lasting impact that results in sustained cardiovascular and respiratory issues, which we already are still seeing today. And the North East has more attributable health deaths to air pollution per 100,000 people than London, despite London having significantly worse pollution. Almost 40% of Black, Asian and ethnic minority backgrounds live in England's most green space deprived neighbourhoods, and they're more than twice as likely to have than as a white person to live in England's most green space deprived neighbourhoods, which is quite shocking. The link between inequality and environmental issues is obviously stark. Air quality, lack of access to green spaces, access to nutritious food, access to good quality green space is massively linked to improvements in mental health and lower levels of obesity, and we're starting to see this with green social prescribing, etc. It is estimated that over 1/3 of new asthma cases might be avoided by efforts to cut carbon emissions. And obviously we know that keeping people healthy has a lower impact on the environment, as they need less treatment and fewer medicines, and that's what the overall aim of our plan is to do. So we want to be net zero by 2030, but actually the health and well-being of our population is intrinsic to that. So back in 2020, the sustainability leads of the NHS in the North East and North Cumbria have had a long established group. We've collaborated on numerous projects over the years, but in 2020 we made things a little bit more official as we moved more towards an ICS perspective. We knew that on the cards after October 2020 we were going to be expected to start putting green plans together, not only from a trust point of view, but from an ICB point of view when the time came, because delivering a net zero NHS strategy was released by NHS England. Basically, this was the pivotal point in NHS sustainability. We'd had a great sustainable development team, but NHSE was starting to really put their money where their mouth is, as it were. So in January 2022, all trusts were expected to have a green plan that outlined their actions, targets, aspirations for the next 3 years. In March 2022, all ICSs had to have a green plan. So we'd started working on this back in 2021. And we got a little bit of funding from Greener NHS to allow us to start putting that together. We did this in a collaborative way. So the CEOs of all the provider trusts had an engagement workshop to really kind of get their views on the high level strategy. Sustainability leads got together through the sustainability ICS group, and our key stakeholders had input to this. So this is something that our plan has been collaborated on with a number of people, and it took over a year to kind of get it to its final state. There is a lot of work to do. It is focused on secondary care because essentially the secondary care trusts are in a very different place to primary care, and we knew that we had to do something separate for them. Otherwise it was going to be a very, very long plan, and we've got to be realistic about who's actually going to read it. So within our green plan, we have 8 priority action areas, and they reflect what is in the NHS delivering a net zero strategy. They are, for us, the pinnacle of how we're going to deliver this. So those priority action areas in our plan have resulted in the working groups that sit below the ICS sustainability group. So they are key to delivering the targets and actions within the plan. When I came into post in January, I asked everyone that was going to the ICS sustainability meeting, and there was lots and lots of people, but we needed to utilise them in a much better way rather than just attending a meeting. We asked them to basically decide which subgroups they would like to be in, because we really wanted to utilise their skills of delivering this plan within them. So we've got 8 priority areas. So we have energy, waste, delivering a greener NHS, climate adaptation, procurement and supply chain, massive group being sustainable healthcare, which some people in this group may already be involved with, and that's split down into other subgroups: sustainable anaesthesia, pharmacy, just starting to look at green social prescribing and primary care. So there's much going on within that. And then our last group is people, and this really helped us define how we wanted the final plan to look and be launched. So the actual text of the green plan was signed off by the provider collaborative and Sam Allen, who is the CEO of the ICS, back in February 22, and we launched the plan properly with all bells and whistles back in July, in the first week of the ICB being up and running. So our plan really is all about being innovative and not being afraid to try new things. Some things we will get wrong. We appreciate that. We want to make the most of new technologies, new ideas, new people that will come into the area. We're seeing some of them now. We saw the Isle of Wight using drones to deliver medicines. We're looking at social prescribing practices. We're seeing lots of new green fleet coming out. Rapid response vehicles, ambulances, these are going to become more commonplace. And we're doing lots of things first. So a lot of other ICS look towards North East and North Cumbria because we do have a well-developed governance structure. We're not saying that we've delivered any more than anything else, but we really already, have been a region of first. So Newcastle upon Tyne hospitals were first to declare a climate emergency back in the summer of 2019. That really kind of gave their aspiration of where they wanted to be. Faculty of Sustainable Healthcare, embedding sustainability into education of our staff. The manufacturing hub at Northumbria Healthcare, developing a local supply chain, but also innovation in terms of recycling of masks, etc. And we're developing an ICS, we have developed an ICS clean air framework to improve health and cut emissions. And that's what I'm going to have a little talk about later. So many of you will already have seen this. This is our North East and North Cumbria NHS carbon footprint. It is based on 1920 data, but it probably hasn't changed too much over that time. And we're just due our next financial year kind of arrangement from the central team who have been sorting out all our data. Obviously, a huge percentage is from medicines and chemicals, and another massive percentages are the impact of our buildings and energy, and that's even more prevalent now than it has been. How we get decarbonisation plans in place, how we're, should we be procuring renewable energy, or should we be putting that money into invest to save? 13% is travel, and that's broken down, as you can see at the bottom. Patient visitors, staff commuting, business travel and NHS fleet. So as an ICS, we're about to start a project that will tackle staff commuting. We've just had funding announced today from the Healthy Futures Action Fund that is going to allow us to do an ICS provider trust travel survey that will help us put modal shift targets in place, not only for the ICS but also for trusts, because a lot of the last travel surveys that any of the trusts did were pre-pandemic, and we're basing strategy going forward on totally incorrect data now. So this is the first, actually. No one's done this from an ICS perspective, so we're trying to lead the way. 1% waste and water. Lots going on in waste. Very, it's highly legislated. Business services, food and catering. It's kind of a stark reminder of what is going on. So one of our big projects that we're just starting to work on was that the ICS Clean Air Framework was launched in June 22. It was a collaboration between Newcastle Hospitals, Global Action Plan and Boehringer Ingelheim, who have come together to put basically it's a free tool enabling ICS leaders to take action to secure cleaner air and healthier future for the region. It can be used across all the ICSs, and it essentially is a very big spreadsheet, and it's very theoretical on all the improvements all the projects you could run to secure an improvement in air quality in your area. And it will drive meaningful improvements at healthcare access points. It can be used to develop a standalone clean air plan, or to integrate and prioritise clean air actions into a green plan. It's a great piece of work. However, it's very theoretical, and we need to make it operational. We also need to know how much time and effort is going to be needed to roll it out in an ICS and use it as a blueprint going forward nationally. So the Academic Health Science Network have very kindly provided some time from one of their project officers to help us do that and kind of make a blueprint for the region that can be used nationally. So the Clean Air Framework is divided into 8 themes that we've prioritised a lot of the actions within each of these themes. So there's some low-hanging fruits that all trusts and ICB is currently doing, we're just not working together on. So digitalisation, e.g. one of the projects is patient given the choice of an online or a face-to-face improvement. And obviously that's happened so much in the last 2.5 years, but it's about actually collecting that data and actually see if we can push that out wider. Engaging patients through educating staff, e.g. medical staff in the ICS, to all be given training on air pollution. So actually this is something we could do through Health Education England, and it's something that would, for a small amount of time, could create a huge amount of engagement of medical staff on the links between air pollution and illness. The infrastructure element, expand air quality monitoring around the ICS. Newcastle Hospitals have just started a joint PhD project with Northumbria University on something very similar to this, about looking at air quality around the RVI and how that potentially impacts patients. Local authority collaboration, and obviously this is key. Ensuring ICS representative at Transport North East local authority transport meetings. We all need to work together to ensure that we're all singing from the same hymn sheet when it comes to clean air. So the travel and transport survey that I talked about before, we've got representatives from Transport North East and the North Cumbria element to actually make sure that we're asking the right questions to staff, so we know that we're going to get the right stuff out, and we can work with them when it comes to what is found in that survey. Do we need better bus routes? Where do they need to be, etc. Strategic decision making, e.g. developing a system-wide clean air action plan, which is something we don't have, but the work that the AHSN are doing will really help us put that together. Looking at the supply chain, transition to sustainable transport for smaller, shorter deliveries. So can we use cargo bikes, etc.? You know, that Newcastle have been doing this for a while, but in other conurbations, could they be used to get rid of ICEs? Transport, all trusts need a green travel plan. And this is what I'm talking about before, that actually our ICS-wide travel survey will give them the data to enable those travel plans to actually be meaningful. And we need a whole healthcare approach, so develop nature-based projects across the ICS region to be used for nature-based green prescribing. And that's something that's in its early days, but there's lots of people that know quite a lot about this, about bringing them all. It's about bringing them all together. So that's one of our biggest projects, that is potentially the one that's going to make a huge amount of difference, but also run for a long time. I'm going to shut up now because I think it's probably time for a bit of a discussion. But contact, that's my email address. Let me know if there's anything I can get involved with, help with, etc.
Brilliant.
I'll
lovely.
stop sharing so I can see you.
Thank you so much, Claire. That was great.